Hey everybody, it's Jordan. I'm going to go over a quick mobility sequence for you. So what we're going to do is start in the 90-90 position. I'm going to face my front knee and turn toward my back leg. If I can't get into this position, I can bring my hands behind my back. Okay, if I can also wrap this hand across my waist and onto the opposite thigh and reach for the same-sided foot here. So what I'm going to do is hold this position, inhale, exhale, breathe a little bit first, and then what I'm going to do is try to pull this foot off of the ground. I might not be able to do that because I'm in this position, so I could cheat by leaning forward, but I'm not going to do that. I'm going to try to actively pull that foot off the ground in this position. So you're not going to see a lot of movement at the hip in either the starting phase or the ending phase. So you don't see a lot when you watch it visually, but you'll know if you're in this position now. So we're going to go into hip internal rotation, hold on to the outside back thigh with a contralateral arm. Ipsilateral arm will hold on to the foot. From here, I'm going to start pressing this knee, foot, and hip into the ground. If this doesn't work, you can bring your hands behind your back, just like that. I'm going to press for about 5 seconds at 5% effort, and then I'm going to build that 10% for the next 5 seconds, all the way to 15%, pressing this whole leg into the ground. You should feel a lot going on this side of the leg, feel a lot going on in the hip here. Press down out into 30 to 40%, 40 to 50%, 50 to 60, 60 to 70%, and hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, and now actively try to pull that foot off of the ground. So actively internally rotate the hip here and hold for 10, 9, 8, 7, 6, 5, 4, 3. You should feel all this stuff here turning on. Squeeze it. 5, 4, 3, 2, and then relax. Okay? Now if you knotted up or cramped throughout that process and got out of that and came back into it, that's totally fine. That's going to be normal at first. If you do cramp though, see if you can try to breathe into that cramp and go through that cramp. Okay, I know that doesn't sound normal, right? You want to just get out of it. It doesn't feel comfortable. But if you're able to endure it, it will succeed and you will be able to relax back into that position. So during that time, I cramped up, but I kind of, just kind of stuck with it, and then it'll fade away the more you just allow your body to relax. So that's kind of normal. Call that neurological confusion. Now what we're going to do is we're going to look forward. We're going to try to sit up nice and tall. And we're going to try to actively abduct this hip off of the ground. So you're going to feel all this tissue here light up. Same tissues here almost, but at the same time, you're going to be using more of your glute med on this one. So we're going to turn that on and try to lift this leg off the ground. We might not see it lift off the ground, but I want you to actively try to. You take an inhale and then try to lift up and hold. 5, 4, 3, 2, and relax. Try it one more time. We're going to try to lift the leg off of the ground, squeezing this tissue. 10-second hold this time, and up. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Good. Now what I'm going to do is focus on the front leg. I'm going to try to lean deep into my stretch. Since I've been here for a while, I can start to begin by pressing this foot, ankle, knee, hip into the ground actively, turning all that tissue on the outside of my hip on. And then I'm going to try to pull this leg off of the ground using the tissues on the inside of my thigh, trying to go deeper into external rotation. Now again, my leg isn't going to move anywhere. And I can see any movement at the hip, but it's going to be all internal. So if you're practicing what I'm doing, you're going to feel the same thing. I'm going to press this leg into the ground. You'll feel it turn on that on that outside edge of that glute. Press 10%, 15, 20, 25, 30. Keep pressing down into the ground. 40 to 50% to 60 to your safest effort for 5, 4, 3, 2, and then try to pull up. Try to get this foot and hip off the ground and hold, hold, hold. 5, 4, 3, 2, and relax. Good. From here, what we're going to do is now we're going to use a little bit more modification. So we're going to be able to get the foot off the ground. We're going to be able to get the hip off the ground. We're going to be able to get that whole thigh off the ground when we perform this regressive angular load. So what we're going to do is lean forward just slightly so we can get the foot off the ground. We're going to take an inhale, push into the ground, irradiate. Internally rotate as you lean forward and hold. Hold. 10, 9, 8, 7, 6, 5, 4, 3, 2. Now hold it here. Now we're going to lean back into our starting position, but as we lean back, we're going to try to keep that foot off of the ground. Try to keep that foot off of the ground and hold until it goes all the way down. Good. Now we're going to do the same thing. We're going to lean out to the side here, use our forearm and lift that leg off of the ground or sit up like this and hold 10 seconds. Same thing. Ready? Inhale, push into the ground. Up. 10, 9, 8, 7, 6, 5, 4, 3, 2, and then try to go back into that position while trying to keep that leg off of the ground until it finally gives up. Now the front leg, same thing. We're going to pull it up, hold 10 seconds, and then try to lean forward and try to hover it off of the ground. Push into the ground first. Inhale, irradiate, lift up, hold, lean back if you need to. 10, 9, 8, 7, 6, 5, 4, 3, 2, and slowly lean forward, hover, and then relax. And kind of hinge forward, hinge back, and then let's get the other side. So go through that same thing. You start with our front femur in front of the hip bone, making a 90-degree angle at the knee. Ankles at dorsiflexion. The femurs that meet are at a 90-degree angle here. And then the knee, back knee is at 90 and back foot is at 90. This is in line, it's on the same line here. So back foot, back knee is lined with the front foot. Okay, so the shins, the front shin and the back femur are going to be parallel. We're facing forward. We're going to anteriorly pelvically tilt our hips. So arch the lower back as our chest comes up. We're going to lean and hinge forward. You should feel that stretch in the upper part of the outer hip. We're going to start with the front and work our way all the way to the back. So what we're going to do is start by pressing the foot, shin, knee, and hip into the ground. About 5% effort and holding here, using our hands like kickstands. So driving that knee into the ground and foot, and then relax. Relax the back leg, relax everything. Try to sit up nice and tall, hinge forward. Go ahead and same thing, press into the ground, 5 to 10%, hold here, and relax. One more time here. Now 5%, 10%, press down, 15, 20, 25, 30, 35, 40. Keep pressing down. Should feel it all in the outer hip matrix there. Press, press, press. 60% effort. All the way to 70 to your greatest effort here for 5, 4, 3, 2. Now we're going to try to pull this foot and knee off the ground, actively using the inside tissues here. It might not leave the ground. Hold, 10, 9, 8, 7, 6, 5, 4, 3, 2, and relax. Okay, same thing with this back hip, but this time we're going to corkscrew ourselves backward, twisting our back shoulder toward that back foot. And we're going to do option 1, hold here. Option 2, you can bring your hands out front. You can even see if you can get the same sided hand to the foot and the opposite hand across the thigh. If you're not able to, hands behind the back. From here, I'm going to press this back foot, shin, and knee into the ground actively, feeling all this tissue start to light up. And then my second stage, what I'm going to do is try to pull that foot off the ground, going deeper into internal rotation. But since I'm here, the foot won't leave the ground. So there's just going to be a lot of active stuff going on. You're not going to see any movement at the joint here. So a lot of this stuff is going to be internal. So you're going to just see me stay in the same position, but when you're following these directions, you're going to feel all the stuff going on in the hip. All right, so what we're going to do is get into a comfortable position, either hands behind the back or wrapping around. Press this back foot, shin, knee, hip into the ground. 5%, 10, 15, 20, 25, 30, 35, 40, wait 50 to 60%, hold. 5, 4, 3, 2. Now actively try to internally rotate. You'll feel all this stuff going on here. It might feel like it's going to cramp up. Your foot might go crazy here like that. Keep holding it. 10, 9, 8, 7, 6, 5, 4, 3, 2, and then relax. Now if you need to get out of that and get back into it, that's fine. I'm nodding up a little bit. I'm having some confusion going on here because I haven't done this in a while. So I'm going to hold and breathe. Now this time I'm going to try to lift this whole leg off the ground. So I'm going to think about this femur just going up off of the ground and the foot off the ground. So I'm using even more of this. I'm going to stay in that same position here as I do that. Or what I'm going to do is I'm going to lean forward. For me, I'm going to try maybe just standing up nice and tall as I do this. Probably a little bit too much to do that, but if you want to do that, you can. I'm going to take an inhale. I'm going to press into the ground first. And I'm going to try to lift that leg off of the ground, use all this tissue here, and hold for 10 seconds. 9, 8, 7, 6, 5, 4, 3, 2, and relax. All right, now we're just going to use that eccentric method. We're going to kind of cheat our way up and then try to go back into that position as we hover down. So facing forward, lean back, pull up and hold 10 seconds. 9, 8, 7, 6, 100% effort. 5, 4, 3, 2, and then we're going to lean forward, try to keep the leg off of the ground, and then relax. Then what we're going to do is back leg here. We're going to lift off of the ground, and we're going to try to sit up into that back hip stretch while we try to hover it on the way down. So go ahead and lift up for 10, 9, 8, 7, 6, 5, 4, 3, 2, and then we're going to try to go into that position while keeping that leg on the ground until it finally gives up. Same thing here. We're going to lean forward, back hip internally rotates. Foot will go off of the ground. I'm going to hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, and I'm going to try to slowly go back to my starting position as I keep that foot off of the ground and try to hover it until it no longer wants to hover, and I'm back into my starting spot. All right, so to kind of clean that up a bit, or to kind of flush it out, what I would recommend is just going through some quick internal and external axials here, going through some hip cars as well after, and then also doing some ankle and knee work here. So you go into some knee work and some ankle work. Okay, so that was a good hip matrix for you. If you liked it, let me know, and we'll see y'all later.